He dialed the phone using a pencil as blood poured from the stumps. They had been ripped off after his shirt got caught in a machine.
Horrible. Hands where they shouldn't be, missing eyeballs, and the cautionary tale of sword swallowing. Today, we are back breaking down and reacting to all the heart-pumping medical scenes and insane injuries from the highly successful animator Zack D Films. Let's dive right in.
If your eyeballs fully popped out of your head, you would completely lose your vision.
Yes. The eyeball itself is multiple muscle attachments, 6, and then you have your optic nerve that comes out the back of the eye.
Well, most people think that you would see darkness.
No, you probably see light.
Black. But that's not actually true. You wouldn't see darkness because you wouldn't see anything at all. It would be like trying to see out of your elbow.
Messing with the nerve could send some wrong firing and might give your occipital lobe in your brain abnormal input. Could there be flashes? Could there be brightness? Could there be absolutely nothing of nothingness? Very interesting, very hard concept to be so black and white on, literally.
There's no visual input, which means you quite literally see nothing. Not darkness, not pitch black. Nothing.
Everything.
If you've previously had vision and then you've lost vision, you won't be able to see, but your brain has previously seen and has images in there. You might actually have visual hallucinations. If you were born without ever seeing, you only perceive nothingness and you don't have any preconceived images in your brain.
When a magician swallows a sword, they completely suppress their gag reflex as it enters their throat.
We place patients in this similar position when we need to do an airway in the emergency department, or even when you undergo anesthesia. You're getting it in a specific angle that before we had technology, we had to visualize somebody's vocal cords when we had to put in endotracheal tube, and we're still trained that way in case technology fails us.
The blade is then carefully aligned as the performer leans back to straighten the natural curve of the esophagus. Then the performer pushes the sword down the esophagus, being cautious not to enter the trachea.
You're going into the esophagus. The reason why you're not going into the airway is because we have different protective mechanisms, specifically your epiglottis. Your epiglottis helps prevent you from getting things into your airway and allowing them to go into your esophagus, so they go into your stomach.
The sword is then stopped right before it reaches the stomach and carefully pulled back up the throat.
The soft tissue of your GI tract, mouth to anus, is very robust and doesn't get cut as easy as we all would think. How do I know this? People swallow things left and right and come to the emergency department. Razor blades, screws, nails, and very rarely do they have any massive GI bleeds or massive injuries.
Last year, a surgeon completely removed a man's damaged eye.
So just so we know, these are good images, but there's 6 muscle attachments to the eye, plus there is the optic nerve in the middle that comes off of the blood vessels. Just telling you.
They connected the eye muscles and blood vessels to a new donor eye.
Cool.
This experimental surgery was done to fully replace the man's eye, allowing him to see again. But the surgeons weren't able to fully connect the optic nerve.
Anytime there is a neurologic problem that we're trying to fix by transplanting, there's always issues with the connection of the nerves. Otherwise, we'd be doing so many different type of procedures. Brain transplants, reattach somebody else's leg as a donor leg.
This nerve is essentially what allows you to see. So while the transplant was technically successful,
technically successful because you can reattach the muscles, reattach the vascular issues, so reattaching the blood supply. Are the nerve cells dead? Do they regrow? Do you get any function back?
the man's vision was not restored.
They showed almost like a cataract type opaqueness of the eye, which you wouldn't necessarily have in that situation. That's a whole different process, but it's just a visual image to show us, okay, that the eye is not functioning.
If you took out both of your lungs and somehow unraveled all of the tiny air sacs, most people say that it would completely cover an entire tennis court.
All the air sacs, aka the alveoli, where the gas exchanges occur.
The average size of the surface area of both of your lungs is only about 1,000 square feet, meaning your lungs would only cover about half of the court.
The lungs are amazing in the sense of expansion, the gas exchange that is occurring, how much vasculature is within the lungs, and even just the touch of the lungs. It's like a really wet sponge in certain circumstances. Such an interesting organ.
If you have frequent nosebleeds, there's a crazy chance that you could have a tooth growing in your nose.
What? This video now is going to change the way I see a bloody nose. I'm always going to be looking for a tooth. It's super rare. The most common reasons why people get bloody noses are due to either a nose pick or a foreign body that was put up there, not because it was there since you were born, as well as some vascular abnormalities.
This incredibly rare condition begins in the womb when a developing tooth bud migrates to the nose. And years later, once the tooth has developed, you might begin to experience chronic irritation in your nostril.
There are two common areas where you get nosebleeds, one in the front on either side of your septum called your Kesselbeck's plexus, and then in the back you can have some posterior bleeding due to other major blood vessels.
To remove it, a doctor will insert surgical instruments through your nostril and carefully extract the tooth.
If somebody comes to the emergency department, what the heck do we do? I hope you come in holding your nose and pinching and leaning forward. Do not lean backwards. If you lean backwards, the blood's going to continue to trickle down the back of your throat, potentially go into your stomach, causing you to be nauseous, swallow blood, and cause some vomiting.
If you get rid of your arm and leg bones, your torso would still be somewhat intact. But if you took out your pelvis, spine, and skull, you would no longer have the framework that supports your body.
Yes, we do see individuals that sometimes have to have bones removed, but a lot of times you're removing the tissue with it just because of the lack of support and increases the risk of vascular abnormalities, injuries, lack of movement, more of a nuisance for the individual.
He dialed the phone using a pencil as blood poured from the stumps where his arms should have been. You see, they had been ripped off after his shirt got caught in a machine.
Horrible. Really good thinking on your feet. This does happen. Please be careful. He's bleeding out. Major blood vessels, brachial artery is just destroyed. Hopefully there's enough vasospasm or spasming of the wall of the arteries that it's slowing the blood down a little bit.
He walked 100 yards to his house and opened the door with his mouth. Then he used a pencil to dial 911. Once help arrived, they found his arms.
What do? You grab the limbs, just grab them and go. Trying to find ice and water bath. Time is of the essence, so get the individual to the hospital. 5-minute ride is not going to do probably that significant of damage if you're waiting 5-10 minutes to try to find a ice water bath to put them in.
Doctors were able to reattach the bones, veins, and skin while he was in a coma.
The question ends up being, was he in an induced coma by intubating and giving medication to put somebody asleep, or was he so out of it due to lack of blood flow to the brain that he suffered brain damage leading to a coma that he's in, and over time eventually came out of it?
He spent weeks in recovery and eventually regained use of both arms.
Wow, amazing. I would say he probably had hypovolemic shock. They were able to resuscitate him and then kept him intubated and down while they did everything that they needed to do.
They connected the blood vessels as they pushed his amputated hand into the incision on his calf. This pumped fresh blood into the hand, keeping it alive.
How amazing is that? And this is actually quite common. It's been going on for a long time. I worked at a burn center in Massachusetts. They were doing procedures like that. It was amazing. It's not like it's just kept there overnight. It's kept there for a while. And so you have to stabilize it and make sure it's okay.
You see, he had gotten into an accident at work.
Oh my gosh, I have a good friend who did something similar, but only took off one digit and he's doing fine. If thought-provoking scenarios like this keeps your mind racing at night, you might need a little help shutting it off. That's where Do Not Disturb could come into play to calm your brain so you can finally get some real rest you deserve. Check it out at lifehappens.com or on Amazon.
And doctors knew they had to act fast, but his arm was too damaged to reattach it right away. And if the hand didn't get blood soon, the tissue would die.
With this type of saw injury, you would expect it to be pretty clean, so that's probably why they were able to reattach it. But if it was like a chainsaw, it might be so jagged that the tissue is so beat up that you can't find the specific anatomy to reattach things to.
So they decided to attach it to his leg while his arm healed. Then, once it was ready, the hand was still fresh, and they were able to reattach it.
Unlikely that they reattached any nerves or anything like that in this area, but giving some blood supply to this area is pretty amazing. It takes a long time for probably the hand to get its nerve function back, but it's alive, it's got blood supply, and giving the patient a chance.
A woman suddenly lost consciousness.
Lost consciousness does not mean that your heart stopped and you died. You could pass out from a procedure. You can have a syncopal episode, decreased blood flow to the brain for a second. If this happens, call 911, get the heck out of there.
While a fake doctor was performing an illegal laser treatment on her.
A laser procedure, which is pretty benign.
9.5.
She must have had just some sort of unique event. Is it laser hair removal? Is it some sort of dermatologic procedure that they're doing that's not massively invasive? I'm thinking, could there be a blood clot that was formed versus somebody just passing out due to the procedure itself?
Instead of taking her to the hospital, he shoved her body into a suitcase. He left this suitcase in his garage for weeks while her family and police searched for her.
Without oxygen, elevated levels of CO2, passing out again, becoming hypercarbic, and then no food or water for a while, which then increased the likelihood of dehydration and potentially dying that way.
To hide the evidence, he buried her body in the garage and poured concrete over it. The remains were discovered nearly a year later, and the man was sent to prison.
Wow. There are individuals that's fake being a doctor, so please make sure that you look up the doctors that you have, make sure they are credentialed. The doctors in the United States, we have to have multiple different licenses for different things and different board certifications if we're working in different specialties. Zack D Films, very entertaining. They do a very good job with the descriptions. Sometimes I want more information about the cases and the info that they're given, but they do a very good job of educating anybody who's watching this and learning from it. So I do enjoy this. If you guys enjoyed my react and want me to do more Zack D Film clips, let me know in the comments. And as always, do me a favor, binge watch this playlist right here, turn on your bell notifications, smack that like button, and make sure you subscribe. That way we can continue to grow as a channel. Thanks so much for watching, and stay healthy, my friends.